All right. Hello, everybody. Aloha. Welcome. Welcome to Talking Story about Alzheimer's disease with Senator DeCoite and Dr. Balaz. We are so happy to have you with us today. We have just a few housekeeping things to let you know before we get started, but welcome to our event today. You're welcome to participate and engage. You'll see at the bottom of your screen, there's a chat box. You can go ahead and try it now. Chat in there. Let us know where you're logging in from. I know we have folks from all over coming to join us today. So if you want to try your chat box, go ahead, let us know where you're calling from. And also we have a great question and answer session planned for you today. So feel free at any time to put your questions in that Q&A box as well, or just in the chat box if you can't find that box. So just so you know, we have recorded this session today and we can't see you, your videos or hear you. Unfortunately, we won't be able to unmute you today, but anything you put in the chat, we will see in the recording. So just so you know. Wonderful. Thank you all so much for being here today. My name is Christine Spencer. I work for the Alzheimer's Aloha chapter covering Maui County. And it's really such an honor to be able to moderate for a phenomenal panel that we have today with Senator DeCoite and Dr. Balaz. I'm going to go ahead and hand it over to my colleague Ian Ross to introduce our Senator, Lynn DeCoite. Take it away, Ian.
Thank you so much, Christine. I have the honor this morning of introducing Senator Lynn DeCoite. Senator Lynn DeCoite lives in Ho'olehua on Molokai, where she's a third-generation homestead farmer. She attended Molokai High School and then Molokai Community College. She's a mother of 3 and a grandmother of 2. DeCoite and her husband own and operate L&R Farm Enterprise LLC, where they grow Molokai purple sweet potatoes. Senator DeCoite has a history of being very involved in her community, including the annual Molokai Christmas Parade, Molokai Ag Festival, the annual Prince Kohio Day event, and Molokai annual Charity Walk. She also served as the parent-teacher-student organization president for Molokai Middle School. Senator DeCoite served District 13 in the Hawaii House of Representatives from 2015 to 2021. During my time with the Alzheimer's Association, she and her staff have always been among the warmest and most supportive of our priorities at the legislature. She has displayed interest in both our legislation as well as our programs, as you can see here today, which is why I was pleased when earlier this month, Lynn DeCoite was appointed by the governor to the Senate. It's also noteworthy that she became the 10th woman in the chamber, the most ever at one time. And her new Senate district includes Hana, East and Upcountry Maui, Molokai, Lanai, and Kaho'olawe. Please join me in welcoming Senator Lynn DeCoite.
So first of all, thank you. Thank you to all our viewers that are joining us today. I really appreciate it. I'd like to give a special shout out, of course, to Christine Spencer and Ian for organizing this event. As you know, it's been near and dear to my heart. Thank you, Dr. Balaz, for joining us and giving us some input on Alzheimer's. To Jacob, our Senate Communications, as well as Rebecca, my office manager. This has been such an amazing experience, and the things that we go through in our lives, COVID has really shown us hardship and the communities that work together. So while we care for our loved ones and those that face Alzheimer's, it's been truly amazing to have the resources available and the expertise from our advocacy of Alzheimer's organizations, as well as having people like Dr. Balaz. So everybody welcome, and I hope we have a very informational and fruitful discussion today. So thank you for joining us.
Thank you so much, Senator. And thank you for being such a supporter of our mission and of really just getting the awareness out to our communities about Alzheimer's disease. Now I have the honor to introduce Dr. Balaz. She's going to be wearing 2 hats today. Well, she wears 2 hats all the time because she's a medical professional and she's also a caregiver. Dr. Balaz is the Director of Nursing at Luna Lilo Home. She's also a nurse practitioner at Kokua Kalihi Valley. Her focus is on neurology, brain health, lauau, lapa'au, and Native Hawaiian health. Her professional passion stems from her personal experience as a caregiver for her father, who's in the end stages of Alzheimer's disease. Dr. Balaz, welcome. Thank you for making time out of your busy schedule. It's really an honor to have you here today. I wanted just to get started, maybe you could share a little bit about your caregiving journey for those of us here today.
Sure. Thank you, Christine. Thank you, Ian, Jacob, Rebecca, and of course, Senator. It's great to be here with all of you today, and thank you for everyone who took the time to put this together. Just a quick little background about me. If you joined the Caregiver Summit, it might be redundant, excuse me, but over a decade ago, my father was diagnosed, but really before that, we started to see the changes happen. Like many of you who are on, or many caregivers begin to hear, there's just something different. Sometimes it's that repetitive questions, but Mom and I started to notice things. It was really hard for me. I was graduating and I had left for the mainland with their blessings, knowing that we still didn't have the diagnosis, but kind of knew what we were looking at. Long story short, I moved over to the mainland. I was pursuing my career. About a few years later, when we got the diagnosis, my mother called me and asked me to return home. So I came home. It was kind of unexpected and quick to take care of my father. And that's really how I got thrown into caregiving. I've always shared that I had a different life journey. I was planning to become a surgeon, and my father's diagnosis turned everything around into geriatrics and brain health. It's a wonderful world. I have no regrets. It's an honor and a privilege to care for him. I would do it again, but it's not without its challenges. And one thing that I do love to share is my medical background did not prepare me for this unexpected role of a caregiver. And it was really programs like the Alzheimer's Association and, creating the buzz, because there wasn't that much of this talk about it when my father was diagnosed. And so it's been a long journey. It's still going. He's in the end stages. I care for him at home. He's total care. But again, there's still a lot of life and love left in this journey, even till the end. So I look forward to talking with all of you today.
Thank you. Thank you so much, Dr. Balaz. Okay, so today, just a little bit about what we're going to go through. I'll share my screen one more time, but we really wanted to, there's a lot of questions as we are aging, as the people we love are getting older, and we wonder, is this normal, or could this be something we should worry about or be concerned about, Alzheimer's or dementia? So today we're just going to quickly describe the difference between Alzheimer's and dementia, and then we're going to just go through the 10 warning signs and share some personal tips and stories with you today. I won't be keeping my screen up the whole time, but I just wanted to show you just kind of an overview, because a lot of people ask, what's the difference between Alzheimer's and dementia? And sometimes we use those words interchangeably a lot. So if you look here, you'll see dementia is an umbrella term, or it's a general term for a batch of brain symptoms for different brain diseases. You'll see that Parkinson's disease is a type of dementia, frontotemporal, vascular. Now, Alzheimer's disease does happen to be the most common of all the dementias out there by about 70 to 80%. But there are many other dementias out there, as you can see from this. Alzheimer's disease is a little bit different than the other dementias. One thing that we know is that it comes in 3 stages, an early, a middle, and a late stage. And then we do have these 10 warning signs that we can look at that are a little different than some of the other dementias out there. So today we'll just get right into learning about some of these warning signs. I'll go ahead and bring up the next slide here. So the first one is memory loss that disrupts daily life. So how do we really know the difference between if this is normal aging or if this is just something that could be a warning sign? So what this means is when somebody might be forgetting important dates, it means they might forget to go to their doctor's appointments, or really they're just forgetting things that disrupt their life in the way that it could be unsafe to them, or it could even, just be something that we need to make sure they remember. Asking the same questions over, repeating things. Those are really one of the first signs that we see, is when the memory loss looks a little bit little bit more than just normal aging, right? When we do get older, we sometimes forget appointments, but we're able to remember them a little bit later, whereas somebody with Alzheimer's disease or dementia may not be able to recall that information because their cognitive ability and short-term memory is really affected. So memory loss is something we see early on. I wonder if Dr. Balaz or the senator have any examples or any tips to share on this warning sign?
So thanks, Christine. And of course, many of us that have those challenges with our family members as they're aging, things like, what about forgetting where you put your keys, names of people, or people you just met? How does that affect or Alzheimer's?
No, that's a great question. And Dr. Balaz, did you want to answer? I saw you come off mute.
You can start, Christine.
Okay, good. That's a great question. And the way I kind of like to describe it, what's the difference between when we're normally aging and somebody that might have Alzheimer's or dementia is, if you misplace your keys, right? Everybody does that, but somebody who has a healthy brain, they're going to be able to retrace those steps. They might walk into the room again, walk out and say, oh, it's like the engine started. It was revving up a little bit slow, but then the engine started, right? That's normal aging. Somebody with Alzheimer's or dementia, that engine is going to keep revving, but they may not be able to collect or recall that information of where those keys were. So that's a little bit of the difference. Is healthy brains, even when we're getting older, we can usually retrace and kind of remember, but somebody who's really impaired cognitively through Alzheimer's, that's going to be harder for them. So they lose their keys and they might be gone for a very long time until somebody might be able to help them find them. So that was a great question. Thank you.
Thanks, Christine.
Okay, so we'll just get to our number 2 warning sign, which is challenges in planning or solving problems. And early on, we do see this a lot when it comes to working with numbers. So some, typical things might be somebody might be not keeping track of their monthly bills. And this is when we might say, oh, this could be a sign, they're usually good about their bills. And now that's a little bit off track. It could be somebody might have need a little bit more time concentrating when it comes to working with numbers. And it's normal. We make occasional mistakes here and there. But this is really when we start to notice, like maybe they aren't able to follow the recipe that they've always made for us. And this is something that we have to look into a little bit further. Any comments on this one?
I think I'd just like to add that this is it's important to keep track of this with the family members, especially with the amount of scams that we have coming out. I've had patients and residents who the family didn't, and it's no one's fault, they just didn't see this coming and realize that their savings or accounts have been depleted. So it's just a very important warning sign to keep out for.
It certainly is. Yes. Thank you, Dr. Balaz. And, just to preface this with, these warning signs are, you have to know the person's baseline. You have to know who they are. If somebody was a little bit, not so great with their finances before, then this might not be their warning sign. But if you have somebody who's so meticulous about they're paying their bills on time and we see things are slipping, that's when we might become concerned. So thank you. Number 3 is difficulty completing familiar tasks. And this means a lot of times we see this first when it comes to driving. Somebody might get in their car, they might forget where they're going. They may get lost when they go out and about. This could also be completing their grocery list every week. They might start having problems with that. Or even if you're playing a card game and they may forget how to play, the card game. So it's those things that are really familiar to them. When you start noticing they might be doing them slower, or they might not be doing them as well as they used to. So we know that a lot of times when we age, we might have some problems with new technology and things like that. But this is something that's really familiar to them, and we start to see that they're struggling. A lot of times it does show up first in driving and or being somewhere and not quite sure how they got there. So that one is a really important one to look out for as well. All right, number 4 is confusion with time or place. And what that means is a lot of times people living with Alzheimer's or dementia, they can get a little bit lose track of the dates and the seasons. And that's where you might see it. For example, if it's really a hot day and you see somebody who might be outside with their coat on, that kind of confusion of time or place is concerning, right? It may be somebody, like we mentioned with the driving, they may forget where they are or how they got there, or what they're looking at may not seem familiar to them. And so this is, when we get older and if we're retired, sometimes we may forget what day of the week it is, right? That's totally normal. But this is a little bit more concerning because we notice that they're really understanding things that are happening to them immediately. So that's a little bit of the difference there on that one. All right, Dr. Balaz.
I just wanted to add in, everybody, excuse me, that confusion is really one of the cornerstones of dementia. And that, as the stages progress, the confusion begins to grow. So if you can imagine when you've tried to use Google Maps and it's taking you like in circles, or it's the holidays and the mall is busy, or you've been in a conversation and you can't follow because you jumped in too late. Well, somebody with Alzheimer's lives in confusion, in that state of confusion, 24/7 from the beginning to the end. It's just that confusion begins to grow. And the more that they progress in the disease, the more, or the increase of confusion they begin to have. So it's just something to get in the back of their head when you're having those repetitive questions, when they're not understanding, they can't answer you, they don't want to take a bath, and you're starting to have behaviors or challenges. It's really that this confusion state is just overtaking at that moment.
Yes, thank you, Dr. Balaz.
So for certain people might find that, it's really hard for them to accept Alzheimer's. So in age-wise, could it be like all of a sudden for some of them, or would it be a gradual process? Does age make a difference on how fast it happens, or whether it gradually, comes to affect the individual?
Dr. Balaz, I see you. Did you want to answer? I saw you shaking your head.
Sure. So what I can say to that is that dementia is a slow progression. It's not an acute, fast change. So usually if we're seeing something that happened within a day, within hours, we're probably not looking at dementia. Dementia is slow progression over time. And as for age is the number one risk factor. The older we are, the more likely, or our greater risk factor grows for having dementia or a type of dementia. As far as the disease progressing, that's an individualized story. There are a lot of people that linger more in the middle stages, but everybody is different. And like my father, he swept through the middle stages fast. So he didn't, he didn't linger there. He went from early, short, middle, and straight into the end stages where, but for everybody it determines. So we always say that dementia, we say early, middle, late, or this stage, or, those are gray boxes. They're not set in stone. And one person can be early for maybe bathing and eating, but be in the middle stage for, judgment and abstract things. So it really determines on the person. Similarities, but everybody's story is their own.
Thank you.
Yes, exactly. And even these warning signs, some people might exhibit, just a handful of signs. Some people might exhibit all of the signs. The interesting and sometimes challenging thing about this disease is that it does affect every individual differently and uniquely. And so that's why, it's hard to pinpoint and say how long somebody could be in each one of these stages, because everybody experiences it a little bit differently as well. So I hope that answered your question.
So Christine, can I just do a follow-up? My grandmother, she was 80 years old, and I noticed that when we used to visit her, she'd recognize some of us and remember our names, and then the ones that came in, maybe like her son, she might call him by her other son's name. is that something natural? As something triggered the mind, maybe bad experience? Because, I start to see that a lot in other families, and they start to bring that up and say, hey, my grandmother will remember me, but won't remember my brother. Is that part of it also? And how does that happen?
Oh, well, that's probably one of the hardest things that families have to go through, right? When somebody you love doesn't maybe remember your face or your name, and it truly is heartbreaking. And we just have to tell people, this is really the disease. This doesn't reflect on your relationship with the person, right? This is something that does happen to many people with Alzheimer's or dementia. A lot of times they can even revert back to many years before, and they may confuse somebody because they don't really recognize the way they look now. They may think they look a little younger back in their mind. But really, we just tell families, this is something normal. There's no really way to say who they're going to remember and who they're not. Just know that it's a part of the disease, and it doesn't reflect on your relationship with that person. And most of the time, what research has shown is even when somebody is in the very end of the disease, they are still able to have emotions, to feel respect, to feel love. So maybe if they don't recognize you, it's okay. You can just hold their hand, show them some love, and they will, most of the time, they'll know that this is somebody important to me. They may not know your name, they may not recognize your face, but they'll feel this is somebody important to me. And a lot of times we don't want to quiz them and say, oh, you remember me, it's your daughter, it's this, that could be a little bit frustrating for them, because of course they want to remember. So what we recommend is, with this happens, just continue to show love. Don't question them. Don't force them to try to remember you. It's there. They'll know you're important to them. Just don't take it personally. This is a normal part of the disease.
Thank you. Thank you very much.
I'm so sorry. Could I share a story really quick?
Absolutely.
Just like the senator's family, I just wanted to share. Just sometimes we have to have a little bit of humor too in this disease, and just right before, also reminding people that somebody has passed. Sometimes that can reinstate the grief process all over again if they don't remember. So be careful. But just wanted to share. Just remind me that my father, I remember. He came home, I came home to visit, and he asked me, who's that sitting there? And I said, oh, that's Mom, that's Moana, your wife. And he looked at me and he was like, what? He's like, who is that? I was like, Moana, your wife. And he looked at me and he goes, ha ha, he starts laughing. He goes, that's not my wife. And he walks away. And then I came back with a picture of my mom in her 20s and like their honeymoon. And he was like, that's my wife. And so, like, just to Christine's point, like, they remember, you can kind of tell how old they are or what period of time they're in when you start to figure those things out. But the confusion state is just, it's a lot to deal with.
And thank you, Dr. Balaz, because I noticed that frustration sets in, especially when family members have to travel abroad to visit their loved ones, whether they're in long-term care and so forth. And, they get so frustrated that they storm out of the room thinking, oh, she doesn't love me. They never come back and they never have the interaction. But, while we've lived through it, and, we try to educate people, we try to tell them, you have to really be patient. You have to understand that, there's several trigger points that literally has to bring you back to a place where the good old days, like you bring out the picture of your mom when she's younger. We do the same with some of our family members, and she would say, oh, is that your sister? Who is she? Where is she? And I go, yeah, but I'm the better looking one. I'm the younger one, and then, they start to have the joking atmosphere, and we kind of have to like turn things around. But thank you. It really helps for a lot of those that have asked the question, like, I don't know how you put up with that and your patience. And, we really got to understand that, Alzheimer's is a disease that will affect many of us, and we have to learn how to cope with it. And I'm just glad that a lot of the resources that we have with the organizations is truly unbelievable and can help make life and the life expectancy much easier to cope with our loved ones. So thank you very much.
Exactly. Thank you for that question. That was a really, really great question. I think so many families, experience that, and it's very difficult. So wonderful. We'll keep moving along. We're about halfway there. Sign number 5 is trouble understanding visual images or spatial relationships. And now this is a little bit different than normal aging, right? As we get older, we may have some problems with our vision. We may need stronger glasses. We may have cataracts, right? That's normal aging things. But with somebody with Alzheimer's or dementia, what they're really starting to see in some of the research is that they have some things going on with their vision. And that could include, having more difficulty with balance, trouble reading if they used to read a lot and now they're not reading so much anymore. It could be spatial relationships, so not knowing how far or how close something is to them. Also maybe with contrast and colors, and this could really affect some of their driving abilities as well. So this one is, just when you start to notice a few things that could be from their vision or having some challenges with vision, this is something to take a look at as well. And there is a lot more kind of research coming out on why it's affected that way. But that's something that we want to look at if we see they're not reading as much as they used to, or they're not balancing as well. Little things like that. I don't know if you had anything to add to this one, Dr. Balaz, because it is a more kind of a medical sign to look for, but I'll hand it over to you.
No, I was just going to say real quick, and this actually came from Dorothy. I love her. We work together. So real quick way to think about it, if we're looking at the 3 stages, is their vision, especially the peripheral, starts to go. So that's why we ask people not to come at them from the side because they'll get startled. We ask that you come in the front and talk to them. But a real quick way to think about it is in the early stages, this is their vision. It's like a snorkel mask. Then in the middle stages, it comes to a binocular. So if you do it to yourself and you look around, you can see how limited. And then in the end stages, it's a really monocular view like this. And so a lot of times I'll have my patients or their families do this. And when you try to grab things, your perception's a little off. You can understand why people begin to trip as they're walking. And so, yeah, we still have a lot of fun doing this. I would make my family do it as my father's stuff would progress. And so they could all understand. And, we would, I'd come on the side with the spoon to them and all of their heads would jerk back. And so, because, trying to be able to experience things that they're experiencing. So that's just a really quick way to think about their eyesight.
Yes, thank you for that. That is true. I think it's good too to kind of see what they're experiencing as far as communicating. It really helps when we can understand the best ways to approach someone and to communicate to somebody. So thank you for that. I think some people are probably going to try that when we get off our call today. I know that I will too. So wonderful. Number 6 is new problems with speaking, with words, with language. People living with Alzheimer's disease, they may have trouble following a conversation or joining a conversation. As we kind of mentioned before, they're in that state of confusion. So when we see somebody who might be speaking, then they kind of stop in the middle of their sentence, this could be something that we want to look out for. Repeating themselves over and over again, this is one of those warning signs as well. And a lot of times it comes with, maybe not being able to find the right word or losing their train of thought, but the language skills and the speaking really starts to get affected. So that's something we want to look at. And this could be also, forgetting the names and the faces of people. It could be forgetting the name of a familiar object. They might call, their toothbrush something else. So really noticing, is there a change in their language, in the way they speak? Are they having trouble keeping up with these conversations, especially if you're out and about and there's a lot of overstimulating factors and you start to see them withdraw a little bit? That's a warning sign as well. We know the part of the brain that gets affected from Alzheimer's disease really affects the language and impairs their abilities there. And so these are just a few things to look out for as well. But I think the repeating and the losing the conversations, that is a very common one that we see come out a lot. Anything to add on that one, Dr. Balaz? Or Senator?
Christine, even within an Alzheimer's patient, and I know we talk about, the frustration of them repeating themselves, but I gotta admit, sometimes there's a good side for them to repeating themselves, because like my kids, they don't listen. So the repetitiveness and the interaction, within the family sometimes can be good. Because, when you tell them, take out the rubbish, the kids look at you like they forget. So it's good to have sometimes grandma and mom or dad to say, hey, did you hear that? There wasn't an echo in your head, but on the flop side of that, you see the frustration in the individual themselves, because they're really trying to focus with their
Yeah.
mind to tell you something. So in being serious about it, it's, again, you have to be patient. You have to have that understanding, because truly the frustration and their mind is just, going, revving. But this is why I believe a lot of the resources that you folks provide helps, meeting with other people that are also living with the same situation with other family members, and to talk about it, I think is really key to helping the families move forward and to deal with this. So that was just a little bit of my mana'o on some of the stuff that I've had to deal with. But thank you.
No, thank you for that. It's true. We have to always find the silver lining too, and with all these things, and really just, keep the patience and don't stop talking to them, still keep trying to converse, but, not quizzing them, just, letting them know that, you're still there to listen. We just take your time, and I know it might take a little bit longer to have a conversation, but just mentally preparing yourself a little bit for that also helps, like, as well, just to slow it down a little and make them feel comfortable, because they are really frustrated, right, with how hard it is for them. Okay, good. We're on to number 7. And don't worry, everyone. We'll send these signs around. You don't have to memorize them today. It's all on our website, alz.org, know the 10 signs. And there won't be a quiz, but we're on to number 7. And number 7 is misplacing things or losing the ability to retrace steps. And we did touch on this a little bit earlier when Senator brought that up, and what is the difference. And we know it's normal to misplace things from time to time, and we rev up those engines, and if we have a healthy brain, we can find those things. But what's a little bit different with somebody that might have Alzheimer's disease or dementia is sometimes we see that this losing things and misplacing things may bring out some suspicion in them. They may feel a little bit more or less trusting of people around them, because in a way it's almost, a coping mechanism for them. If they're losing things, sometimes it's hard to admit, I keep losing everything. Somebody just took it, and that's something that we really want to look at. If we see that somebody is a little bit more suspicious, if they're telling us that somebody came in my house and took this or whatever, that's when we want to say, okay, what's going on here? Let's investigate this a little bit further, because they have lost that ability to retrace their steps. Naturally, it might just come out to be a little bit suspicious of other people. And so we just really want to let them be heard and tell them, we'll help you find it, and just really, avert any crises that you can with that. But that will be a sign that we see is the constant losing of things. And, we tell families too, just to get duplicates of things, get extra copies of the keys, have certain ways where you can, handle those challenges day to day, because it's a very common thing. And it can be very frustrating for many people for that one. So that's a little bit about sign number 7. Anything to add?
I don't think too much. I just share, sorry, sometimes in this phase too, they like you were talking about, Spence, they accuse you of taking their things. And so it's hard to deal with. There's no easy way to deal with it. I mean, so I'll just share, my father for some reason loved toothpaste and like change. And if you walked past him and you had change in your pocket, he wanted it and would not, give up. He got it. So sometimes, some of the things we did, even in the nursing homes, like they like my shiny bracelet, when they're fixated and you can't redirect them, we just carried around extra change with us, and we would just take it out and give it to him. And he would put it in socks and tie it up and hide it around the house. And he would hide toothpaste too. So I used to when he would go to sleep, I would gather all the toothpaste out and get all the pennies back. And then because he would hide it in bookcases in the refrigerator, and I would try to find it. I didn't find some till we moved out years later, but I tried my best. And then the recycle would start the next day. He'd want toothpaste, I'd hand it out. And then I used to turn it into games, like hide it places and have him find it, see how much I could find at the end of the night. Did I give him 10? I could only find 8. And then, yeah, I just always had change. So sometimes it's developing things like that, where you're going to give them what they want and just, turn it into a game or have fun with it. Yeah.
That's a great tip. Thank you. All right, good. We're moving along. Senator, did you have anything to add to that one?
Just the fact that, you have to interact with them, don't make it to be such a hardship. Yeah. So I can appreciate what Dr. Balaz said, because my grandmother, she was the background behind our farming and us growing up. And she constantly liked to be in the setting of a farm or agriculture. So sweet potato, she always wanted sweet potato. So, she'd constantly say that. And then, we used to do sweet potato pies. Well, dear friend of mine, I'm horrible at baking and stuff. So I try to mix it up for her from the different colors, maybe purple and stuff. And, I try to see if she could actually, know the difference in the types of potatoes that she did have. And she did, but that made her happy. So we kind of had to find the happy place, just like what Dr. Balaz is saying, and then just go with it, because as you know, Alzheimer's, their personality can change really fast. And they can bring up something that can really hurt you in a memory that will trigger it. And I think this is where you got to go back to that happy place that you have with them to settle down the aggravation and the anger that you can also incur while trying to work with them and help them to understand what's happening. So I like what Dr. Balaz just said, finding but thank you.
Thank you. Thank you, Senator and Dr. Balaz. Those are great, great examples, and exactly echoing what you said, Senator, is, we just need to support. We're the ones with the healthy brains, and we can control, our own frustration and things. So if we need to have a lot of sweet potatoes on hand to give to grandma every few hours, that's what we're going to do, right? So thank you both for those tips on that one. So we're up to number 8, and the warning sign is decreased or poor judgment. And what this means, we discussed how a lot of times we might see that come out with finances or with money. But another place where this poor judgment might come out is with their grooming, with their hygiene. You may notice that somebody isn't taking as good as care of themselves as they used to. They may not be, showering as much. They may be just forgetting to do these things, right? We know that could be a part of the disease. And so, we know, as we age, sometimes we may forget to, change the oil or do things like that. But this is a little bit more serious. This is when we really notice that this person is having some issues with their hygiene or just really taking care of themselves in the best way. It could even be with their diet. If you notice they're not eating as much, they're losing weight. These are some areas where we really want to look into that their judgment is impaired in this, and we might need to step in and just remind them or help them to take care of themselves in some of these ways. So decreased or poor judgment, this can also come in social settings. Somebody may say things that are really inappropriate or maybe, a little bit vulgar or something. It comes in a lot of different ways. But one way that, we can definitely see is we can look at the hygiene and we can say, is this person, doing their daily things to take care of themselves as well? So that one is, I don't know if you have any examples to share for that one, Dr. Balaz, okay, or Senator, but that one's pretty straightforward, right? We just know that if we notice somebody needs a little bit more help doing those daily things, then we need to maybe ask a few questions and step in a little bit. Number 9 is withdrawal from work or social activities. And this is definitely a sign if you have somebody who's always been really socially engaged, always loves spending time with the family and the grandkids, and now you notice that they don't want to come out as much. Maybe they're really going into their shell. And this could be a sign for that person. Sometimes we see people when they develop Alzheimer's disease, they may not do the hobbies that they used to do, playing cards or doing things because it's becoming more challenging for them, right? And it becomes more frustrating. We may see that, they may not be able to keep up with different activities or games that you do around the house. But it's really when we notice that they're withdrawing, socially. And, that's normal a lot of times. When we age, we're kind of set in our ways and we don't have as much energy to do all those social things that we used to do before, right? That's normal. But when it's not normal is when we really start to see them close off, and we can really kind of, wonder if this is somebody that was really socially engaged before. This would be a sign that, perhaps they're having some challenges that we just want to bring up with them. All right, Dr. Balaz.
I just wanted to add in, Spence, caregivers, just please remember to implement self-care. Isolation doesn't just happen with the people we care for. It happens to us caregivers too. As it progresses and they need you more, you also begin to get isolated also. So just for caregivers, keep an eye out on that also.
Absolutely. Thank you, Dr. Balaz. That is very true. And for any of our caregivers out there, we do thank you for all your hard work. We know it's not easy. So please make sure that you have some social engagement in your life as well. Okay, we're getting close. This is number 10. And the 10th warning sign is changes in mood or personality. A lot of times people with dementia may experience some changes in their mood. They might, as we know, they become more confused. They might become more suspicious. They could become depressed. They could become more fearful. They could have more anxiety. There's a lot of different things that could change with their mood and personality because of this disease. And that's something we want to be aware of. We know that a lot of times when we're older, as I mentioned, we have a specific way of doing things and we like to do them that way. Sometimes when the routine gets mixed up, we may not be too happy about that. And that's normal. But what this means is, when somebody gets really easily upset, maybe they might have more outbursts with their friends and their family, or really you just notice that, there's a change. This person used to be a little bit different. And what could that be? What could that change be from? And that's something that we really want to think about in regards to Alzheimer's disease and dementia. So that is sign number 10. We got through them. I know we have a lot of great questions that came in for us today. But before we move on to some of the questions, I had a question actually for Dr. Balaz, and I wanted to, what would a family do? What should they do if they see these signs in their loved ones? What's the first step they should take?
Thanks, Christine. So I would encourage people to go and see your PCP or provider, because early detection is something that we're really trying to push right now. So the earlier we get in, the earlier the diagnosis, the earlier interventions, the better the outcomes. I would also encourage caregivers to be an advocate. There are moments when maybe the provider is not, or that 50-minute snapshot that most providers get compared to your everyday with them. So if you're feeling that you're not being heard, if you're feeling there are changes, advocate, push for it. If your loved one is at the age to bring on a geriatrician, I would highly encourage you to bring on a geriatrician who is well versed, whether it's an MD, DO, or APRN. And they will usually, especially in the early stages, bring on a neurologist. So you'll have a care team that can come in, but your care team is also your community, your family, and other therapists. But yes, go in, push for it, get the diagnosis, do the test. They're also going to be looking for things that maybe are reversible, that mimic dementia. So that would be my encouragement. See your provider right away.
Exactly. And I echo that because it may not be Alzheimer's or dementia, right? It could be anything. And it's really important that we know what we're dealing with, right? So we can treat it. And so we can really, make sure they have a good quality of life, the best that we can help them have during this time. So we did have a lot of questions. Senator, did you have a question? I can start with you, or I'll just go ahead with the questions from the chat.
Sure. So, of course, thank you for showcasing the 10 signs of Alzheimer's, and Dr. Balaz, thank you for your expertise and your recommendation. Please go see your PCP and get diagnosed correctly. So I'll start off with the first question, and it says, my parents still insist on going to the doctors by themselves, won't let them come. Is there a way for me to express my concerns to their doctor? And is there a way for me to get information from the doctor about my parent?
Dr. Balaz, I'll let you speak to that one.
All right. Yes and no. Technically, no, if you're not the guardian, or you don't have power of attorney, or you're not the guardian of their healthcare decisions. I would say though, if you have concerns and your parents are not letting you come, you can still call their provider and leave a message and speak with them. That does not mean the provider is going to share any information with you, but at least they can hear from you what is going on, and maybe they may act on it and try to ask questions or run some tests when your family returns. Now, Hawaii is a very small community, and sometimes you can have those conversations, but it would be, of course, against HIPAA for us to reveal any information without consent. So, but just know that you can still call the provider and leave your concerns with them. I cannot say what they will do, but at least the provider is aware of other things that are happening.
Thank you. And Christine, can I do a follow-up question?
Absolutely.
So, Dr. Balaz, with a power of attorney, is my parent giving up their decision-making abilities?
So I will first say, Senator, thank you for that question. I'm not a lawyer or a judge, so I would try to give my best. From what I've understood and learned is there's different types. And if anybody in the audience, I'm wrong, please chat, correct me if I'm wrong, and we can check. But providers, we can write letters of capacity saying that what we feel, if this person still has the capacity to make decisions or not. That letter can be used to be taken to court. Only a judge can declare somebody incompetent. Now, POA, there are different types, so you have to look into what types. There are some that say that only when I cannot make decisions will then the POA be able to take over. There are other ones that they turn over their rights right away. So it really depends on the wording, and like my residents, there are so many different types that I get to see. I have to read them all the time and ask some of my colleagues to interpret for me. I've done them. I am the POA for both of my parents. My mother still has decisional capacity, so she still makes all her decisions. Be careful with dementia, because how do we determine that somebody isn't at that point to make? Dementia is you would then need that letter of capacity. So we really encourage that families do these letters and get all the legal things sorted out before the person is not able to say their wants and needs, because it really becomes a very difficult and challenging situation for you to be able to take over then. So
Thank you. Thank you, Dr. Balaz. Appreciate that.
Thank you, Dr. Balaz. Senator, do we have another question? I see there's also one in the chat, but I'll let you go first.
Sure. So how to get professional help, whether it be diagnosis, whether it be options, etc. And if they refuse, how do you handle that?
That's a good question. And that's a very tough question when, there's a lot of people that may not want to go to that doctor's appointment and find these things out, right? But, I think it's just really important just to speak to them first, to bring it up, to start the conversations with them as well. I'm going to mention a lot about our Alzheimer's Association resources for folks, but we do have a lot of great resources out there, ranging from support groups for the family members to go to and try to work on these, challenges together, to just some classes and different, we have a helpline, a 1-800 number as well. So I would say the first step would be, start those conversations with the family member. get out there and get some of the resources that are available for Alzheimer's and dementia, and really just keep trying, don't give up. I know that some people have many tactics too, where they might say, oh, we're going to go get lunch at your favorite lunch spot. And then they kind of sneak over to the doctor, before lunch. So there's a lot of different tactics that you can take for that. But Dr. Balaz, did you want to add anything to that? Because I know you work a lot with, Hawaiian medicine and things like that as well. And I don't know, what would you add maybe if somebody was resistant to the doctor?
Yeah, that's a difficult one. If we're talking about just getting them there, well, now we have telehealth. So that's definitely a huge option because you can do that at home. So telehealth has really expanded us. Doing things that what Christine said, like let's go to do this, and then you somehow segue in there. Sometimes as a provider, like I would meet them outside because once they see the building, they don't want to enter the doors. If they're still in the early stages, they're very well aware, like you tricked me, I told you I don't want to come here, I don't want to do this. Sometimes we come from the part like you're helping us. So like you're actually helping us to help your daughter. So if you could take these tests, it's really for your daughter or someone. We try to come at it from a different angle. Sometimes we try to make it that they came up with the decision themselves. So there's a lot of techniques, like being a caregiver or in this field, it's like you always got to think out of the box how to do something. I always tell people, think about when your children were small and you had to bribe them and things you did to get around. We're really going back in time. So a lot of those techniques will work. And then you brought up La'au. I don't have anything to say about what is the best route, Western medicine, Native Hawaiian medicine, Chinese medicine. I think it's what you are comfortable with. Personally, I do Western and La'au. For some people, that is not an option. For some providers, that is not an option. So you have to find the provider that's going to work with you and what you feel comfortable doing, what you feel is right.
Thank you. So I'm going to jump into the next question because we have a lot of questions, Christine. So can seniors in their mid-80s be newly diagnosed with Alzheimer's? And is there any age that memory loss, etc., can be attributed to the natural aging process?
Well, that's a good question. We know that people over 65 are more at risk. So somebody can be diagnosed. I believe Dr. Balaz, let me know if I'm wrong, but at any point in their life, they could be 80 years old and get that diagnosis, so it doesn't matter the age, you can go in, get diagnosed, and, all the risk factors are different for different people, but it really is, after 65, that's when you want to start thinking about talking to your doctor with this if you're seeing some of the signs. I hope that answered that question.
Yep, it did.
Okay.
So I'll follow up with another question. Is there research on new drugs to help with Alzheimer's?
Yes, and a very, very, very newsworthy time right now with what's going on with Alzheimer's research and medications, and quite a bit of debate. Probably not enough time today to talk about all of the different elements of what's happening, but yes, there has been an FDA approved new treatment for Alzheimer's disease out there called aducanumab or Aduhelm. There are pros to cons like everything out there, but what's really exciting for our association with this is that, it's invigorating research for treatments, for a cure. It's a step forward really in a lot of ways, which is a positive thing. There are some elements of it that our association is concerned about regarding the cost for this drug, especially for our communities here, could be over $50,000 a year. To us, this is completely unacceptable, and we are at this time calling action to bring that price down, for our families and our communities. But as of now, it's also up to the providers to whether or not they'll be, providing this to families. So a lot really in the pipeline with that one, a lot of debate, but I think, there's also a lot of hope that comes with this as well, and just moving forward with science and research, and just, hopefully someday this will lead to the cure. So thank you for asking that question.
Christine, and I want to say, with the COVID going on and vaccines, how reliable is the drug or the drug to reverse it? And how many people, or should I say families, that have been able to have drugs used to treat Alzheimer's refused it because of the fear of reliability?
Yeah, that's a great question. And every family, it's a personal choice, right? What they want to do. As of now, none of the drugs are going to reverse the disease, right? They can help with symptoms. This particular new drug, it's different than the ones out there because it is tackling more of the underlying causes of the disease, such as the plaque buildup and tau. However, nothing is going to, as of now, is going to reverse what has happened to the brain already. These medications are there to alleviate symptoms, to help the person have a better quality of life, and to really, pinpoint some other areas that may help the families. But as I said, it's really an individual choice up to families. There's a lot of holistic things we can do as well, out there. So there's options. There's definitely options. But to answer your question, nothing right now that we have is going to reverse our effect of what has already happened in the brain. Hopefully someday.
Thank you, Christine. So another question came in is, over the course of your years of experience, Dr. Balaz, in the field, are there proven ways or methods to prevent Alzheimer's?
Prevent, what I guess in some ways would say that we have a cure in a way, right? To stop something from happening totally. So I would say that at this time, we know that there are things that will increase the risk factors, such as age, such as what you're eating, your diet, exercise. You really say what's good for the heart is good for the brain, right? What chemicals have you exposed to? What kind of job did you have? There's environmental factors. There are just lifestyle factors. There's so many factors involved that at this time, we can't say like, if you ate that, you're guaranteed going to get Alzheimer's. If you did that, you're going to. So it's a combination of things. So when we start talking about healthy brain and decreasing your risk factor, we start taking all of that into consideration, and that comes out in the education to the patients.
Thank you, Dr. Balaz. I used to always get the comment from my aunt, and she would always say, stop eating those canned goods. Canned goods is what's making you get Alzheimer's. And I'm like, really? So a lot of, scare behind that and processed foods. And I think the number one rule is if you don't know, don't eat it, and, try to live that healthy lifestyle. So thank you for that. So another question came in, and it's basically, as a new caregiver to my mom with early onset of dementia, is there any recommendations for not giving access to stoves or other household items that could be dangerous, like knives and matches and so forth?
Yes, I think it's definitely important to think about the environment and your home safety when you have somebody with a Alzheimer's or dementia diagnosis. We want to prevent any of those accidental injuries or deaths. So there are many resources also on our website for home safety at alz.org. But it's really just taking a look on a checklist. What do we need to do to make sure our home is safe, to make sure somebody doesn't, leave the stove running or drink something that could be poisonous, right? So I would say if you're concerned, go ahead, look at those checklists that we have online and just go through them. There's a lot of different techniques out there. Some people even take off their stove knobs while they're away from home. So there's different ways to do those things, but I would say, go ahead, look at a home safety checklist at alz.org, and that'll help you make some of those decisions.
Thank you. So I have a question coming in from Molokai, and of course, we've always been lacking resources. One of those questions is, how can we get a specialist to deal with Alzheimer's to Molokai to care for our loved ones? And this would go for all of our rural and isolated areas.
That's a great question. And thank you for our folks here from Molokai. I certainly miss getting to go over there. I know it is a little bit harder to get those resources there, but our association, we do cover that area. So if you really don't know where to start, just give us a call our office. I'm going to share a little bit more briefly about all the different resources available to folks. But I think we hope that, we'll get more resources out to these rural areas. But in the meantime, we are here to help families. We also have that 1-800 number. That's a place to start and just kind of see what's available around. I hope that answered your question. I'm hoping that, down the road, we'll get more specialists out there. But now if they feel like they don't have somewhere to turn, they can start with the Alzheimer's Association, and we'll see where we can find what is available locally. Sometimes it's a matter of just not really knowing what's available. So thank you for that question very much.
So thank you, Christine. And then for our viewers, we are putting contacts. The phone numbers, 1-800 numbers in the chat box. You can grab some of the information there. We'll continue to drop information. And of course, by all means, you can continue to share the page here so that others have the opportunity to listen in. So I'll do a follow-up question, Christine. What would it actually cost to have an individual on island or in the rural areas, even as a part-time for Alzheimer's specialists on an island like Molokai or Hana in those areas of rural and Lanai?
How much would it cost for families?
No. For an individual doctor or someone like Dr. Balaz to maybe relocate to Molokai. No. Lanai, no.
Oh my gosh. I wish we had our hands in the works of that, but I'm sorry, I don't know if that's a question I can answer. We know that it is expensive, even just for the families. They average it to be over $100,000 a year for families who take care of somebody at home with Alzheimer's or dementia. So I'm sure the prices range, but we've heard you. We know that's something that is needed, and if there's anything we can do to help, to help make that happen, we certainly will.
Thank you, Christine. I had to throw that out there.
Oh, no, that's great. I just wanted to mention we're right at 11 o'clock. I know Dr. Balaz might have to sign off, but I'm going to be here to get through the rest of our questions. But I know she's got another meeting she's going to run to. Were there any last questions that you wanted to direct to Dr. Balaz?
Yeah, Dr. Balaz, can depression, anxiety, stress, and the trauma lead to Alzheimer's?
I think again, it's really a combination of things that can lead to it. There are things that can, I guess, help it accelerate. Depression can mimic Alzheimer's, like specifically talking about that, which is why we ask that the tests get done or a behavioral specialist comes in to talk to them. And also a lot of people with dementia become depressed. I should say a lot. They have a chance of becoming depressed. And then we still bring on behavioral health specialists. PTSD and all the other things brought up can be factors in attributing to it. But I, like before, can't say like, yes, if you have that, you are definitely going to get Alzheimer's. It would be a combination of a lot of things.
So I have two more questions I want to throw at you, and Christine, I'll save you for the rest. So one, is Alzheimer's inherited, and are there supplements that can prevent the onset?
This question. So supplements, we got to do the research. Again, it depends. There's a lot of research that came out that, right, there's things you can buy over the counter, Walmart and Longs, that they're saying don't improve, like ginkgo and all of that. But then there's people who swear by it and believe in it. So the placebo effect is real. I'm not encouraging, I'm not saying one way or another. I would just leave it as with my families. I tell them, as long as there's no interactions, that's a good thing. If you're going to do things that your Western medical provider is not prescribing to you, please let them know so we can check for interactions. That's really what we're worried about, is if there's, anything that could be detrimental. But, I give my father La'au, specific medicines aimed at targeting the brain. And I feel that it helped. Maybe I'm biased because I want to see things that aren't there, but I feel it helps, and I continue it. His providers don't mind, but again, it really comes down to the family deciding what's most important to them.
So Dr. Balaz, I like the fact that you said that and you do practice Hawaiian medicine. A lot of the families that I know of that do go to the Western ways of taking their loved ones in to get treatment. And I'm going to ask this, what if they want to contact you and say they want you to treat them? Because I know a lot of families that do want to use Hawaiian medicine. Can you put your number and contact in the chat box too? uh,
My email, and yes, anybody can email me if you want further information. I work for an FQHC, a health center, so I'm kind of tied to that area. But like my kumu, or who I've learned from, has huge experience behind him, as well as many others. They are out there. I mean, that is exactly who helped me on the journey and who began making, the prescriptions and for me and my father, and then I just carried it on. So there are quite a few out there, and if anybody is interested, and I'm sure that they would know if there's any people to contact on your own island, also make it a lot easier.
So I got one last question, and I know you got to run. So the question is, do people with Alzheimer's begin exhibiting more suspicions about others' actions, which I mean like stealing or missing possessions?
So it depends again on the person, but great question. Sometimes they do. It's like what I was sharing about my dad, the pennies. So it wasn't just that he wanted the pennies, he thought that we stole his money. So that was the driving force why he wanted it back. We always had to close the windows because he thought everybody was looking into our house. I think that was some memories from childhood. So sometimes when I even had a patient who would just cry all the time and run out of our house. So sometimes it's like me sitting down and really figuring out where it's coming from. Is there a trigger from the past? Was there something that happened? And like for that woman, her son had been taken from her. So she always thinks that her kids are being stolen. Yeah. My father, it was something growing up. They always closed the window. So that was his thing. So it can happen. So it's really finding out why, and then we try to work around that. What can we do? What can we do about it?
Thank you, Dr. Balaz, and I'll take it right back to you, Christine.
Wonderful. Thank you, Senator. And thank you, Dr. Balaz. I know if you have to sign off, that's okay. We'll just wrap it up. And thanks for everybody for sticking with us a little bit 5 minutes after our time. But yes, there was just one more question I saw come up in our chat box here, just asking, how can we get in touch? So I want to, with the Alzheimer's Association. So I just want to share my screen with you and show you a little bit about what we offer locally for families. Everything is free of charge, of course. Thank you to the generous support of our community and all of our donors. But we're just a phone call away. We offer care consultations. That is just an individual time to talk with one of our representatives. We have people on every island, and it's really just time to ask any questions, help make plans for the future, and really just take that time to figure out what's next with this. Our 24-hour helpline, as I mentioned before, is an incredible resource. It's 365 days a year, so it's great for caregivers. You can call at night, you can call on the weekend. Maybe if you can't call during 9 to 5, calling our helpline is just a great way. And our professionals there can answer any question at all that you have. We have classes like this, Know the 10 Signs. I saw in our chat, we're having a brain health class tomorrow. So please check out our alz.org/Hawaii website. You'll see all of the different training and classes that we have. We do a lot of Zoom classes, and then we'll be doing some in person down the road again. But our support groups are also a great way to talk story with other families and people going through the same things that you are. So getting in on a support group, there's many different ones to join each month. And then we also provide information and referral. And really what that means is finding out who in the community we can connect you with. We have over 100 different partners on Maui at least, and I know all over the state. We've got some great other agencies and nonprofits that do some good work. And so we help lead families, to these other resources that are available to them as well. And that's really the bulk of all of the resources that are available to you. As I mentioned, everything is free. Please call anytime, check our website. We also have a really great Facebook page that you can check out as well, Alzheimer's Association Hawaii. And I think that wraps it up as far as our local resources and ways you can get in touch. I really do hope that you don't hesitate to reach out at all if you need any support from us. Senator, did you have any last comments or questions?
So of course, Christine, I'd just like to say thank you to the Alzheimer's Association, to you, to Ian, to Dr. Balaz. Thank you to our viewers, and we'll be sharing the information. If you want more information, we do also do send-outs, stuff that Alzheimer's puts on. We can share it with you. You can contact us at our office at 587-7225, or you can also contact us at Sen DeCoite at capital.hawaii.gov. So when Alzheimer's puts on events, we try to share whatever's happening in the district. And of course, mahalo, Jacob, for sending this out and our communications via Senate. And please don't ever hesitate to call us. And thank you. This was such an informational talk story, and I really appreciate it. So I hope all of you have a great day. Be safe and take care of yourself. Thank you. Mahalo.
Thank you. Thank you so much, Senator DeCoite.